everyone, my name is Taylor Blaine. I am an occupational therapy student at SVSU. Today I'm going to be talking about my occupation-based kit. My occupation-based kit involves a common treatment known as mirror therapy. I designed this kit for a client named ML based off of her specific functional deficits and values. The OBK that I created is called Reflect to Correct. So the OBK was created to easily be used in the acute care setting so that the hospital tables can be adjusted up or down depending on the client. The kit I made combines mirror therapy with a functional activity of playing cards. So I chose the occupation of playing cards because the client values her time playing cards with her family and friends. She used to play cards with her card group once a week before the CVA, and the CVA has interrupted this role. So she hopes to get back to playing cards as soon as possible. The kit should improve the occupational performance of playing cards with the affected extremity. So the main goal of this kit is to improve the client's ability to perform the occupation of playing cards so she can get back to doing this meaningful occupation. The PICO question that I researched is, among clients in acute care who have experienced a cerebral vascular accident, does mirror therapy improve the ability to deal a deck of cards with the affected hand? And the client's specific goal is ML will deal a full deck of 52 cards with modified independence using the affected hand while sitting at the edge of the bed within 3 weeks. ML is a 72-year-old female. She was admitted into an acute care for ischemic cerebral vascular accident, a CVA. The client values playing cards with her friends and wants to get back to this meaningful occupation. The client presents with decreased right upper extremity muscle strength and right upper extremity fine and gross motor coordination. These functional deficits have impacted her ability to manipulate the cards. In addition to this deficit, the client also required moderate assistance for activities of daily living, such as grooming and hygiene. So in this example, his left hand would be the affected extremity. So this is him just showing you how it's working, seeing that reflection of the other hand, giving that impression. So this is where the therapist will show the client what is expected during this treatment session. So first, he will be shuffling the cards with his right hand, and then he will be dealing into 2 piles between the therapist and himself, and then he will flip the cards as if he was playing a game. So this is just the client completing those 3 activities. So based on the results of the literature review, it became evident that mirror therapy is beneficial and effective for patients who have experienced stroke. There was a significant amount of evidence available towards this treatment. Mirror therapy is based around the idea that the reflection of the strong side will give the impression to the client that their weaker side is moving. One study involved a control group who completed conventional therapy and an experimental group who participated in mirror therapy combined with the exercise and conventional therapy. This study found that the experimental group improved in upper extremity function and ADL compared to the control group. Mirror therapy can also be effective in improving gross and fine motor function of the paretic upper extremity. In addition, the research shows that mirror therapy and conventional therapy combined in treatment less than 4 weeks long showed improvement in motor function according to the Fugl-Meyer assessment, the functional independence measure, and modified Ashworth scale. Through the integration of evidence based on practice and the use of clinical reasoning, it can be assumed that the use of mirror therapy will assist in improving the fine motor skills and upper extremity function that are necessary in manipulating cards. When the kit was implemented on the client, there was a few modifications made to the OBK. These modifications were just physical changes to ensure it would be implemented smoothly. When I took it to use with the client, I realized that the mirror part was kind of top-heavy. I had to hold it during the treatment session so it would not fall. To fix the problem, I reinforced the back pieces of wood to help the mirror stand up better on its own. While implementing this, I found it kind of difficult to make sure the client and the mirror were correctly positioned to ensure the client was able to interpret the reflection as their hand. This took a few minutes. The whole treatment session took only about 10 minutes. I thought it would take longer. In addition, mirror therapy is a treatment that takes time to see results. Due to this, I was not able to see an immediate increase of an improvement in performance skills. However, the client said that this activity was a good idea and that it was crazy that something so simple such as mirror and a cards could be so helpful. It was evident how excited she was about getting back to playing cards. The OBK is a skilled and justifiable service due to the fact that OTs can use clinical reasoning and their knowledge of anatomy to modify and grade the activity based on the client's performance.